Who are these two watching now? So, meron na po tayong kasama dito. Sino po ito? Nanonood. Still, nagpe-prepare pa ako para sa lecture on COVID-19 or infection control training. Sino po itong kasama natin ngayon dito na nanunood, nakapasok dito sa ating LS? Welcome po. Pa-chat naman kayo dyan para malaman lang natin kung sino itong kasama natin. Dalawa na nanunood sa atin ngayon. Pwede na rin patamsak dyan. youtube.com. Hello? Apo. lecture muna then competency. Si Marie Chris sabi niya sa'kin, sabi ko, "Tapos ka na 'di ba, nag-attend ka na?" Sabi niya, "Oo, kaso lang gusto ko pang ano, gusto niya pa daw ng information." Imbes na i-print yung ano, sabi ko, "Makinig ka na lang ulit." Kaya sabi ko, meron namang online mamaya, mag-attend na lang siya. Kung gusto niya, umattend siya sa auditorium, otherwise kung may ginagawa siya dun sa ER, puwede naman siyang kumonect para marinig niya online. "Ate, busy ka? Patulong ako sa competency mamaya." Kasi pagkatapos ng lecture ko usually isa lang, nakakadalawa lang ako, eh. Ay, uwi ka na ng 2:30? Ah, sige lang, okey. Hmm, nababawasan pa. Ayan, rest. Eto, pwede na. Pwede ba nating malaman kung sino po yung kasama natin dito ngayon? Merong manunood. Kailan kaya dapat kapag ganyan, siguro, yung service time. Kasi meron silang service yan. So, ilalagay yung education. ER tapos naman na, di ba? Pwede ya. Meron kasi dalawa lang. ER o PD. Sige, pascan ulit. Tapos i-send natin. Ipascan mo kay Annabelle. Sabihin mo, send me, please, to me, tapos share natin sa'yo. Para diretso na. Hmm? So, ano yung isa? Kasi magkakasama para hindi tayo magkalituhan. Hindi. Hindi ko alam kung anong reaction niya eh. Nagulat ba siya? Hindi ako nagulat. So, hanggang uwian ka na ba? Ba't di sumasagot yung kasama natin dito? May nagwa-watch pero paiwan naman ng chat. Is it English? Is it English? uh, Somebody's also watching now. So can you just leave a comment in the live chat so I know who are watching us right now. Oo. Oh, tatlo na. Sino yan? Now we have three who are watching right now. Can you just drop a message so at least I know who are with us right now? Or Tagalog ba? Pwede bang ang hirap ng English? Baka duguin ako. Huwag mong iwan. Iwan ka. Alis ka na. Wait, summary. Oo. I-coordinate mo na lang sa LNT at saka sa OR para alam nila. Oo. Sila naman expert dyan. So, we will facilitate. Ay, shit. Kailangan ko ng print out from Annabelle. Wow, English. Baka makikinig. Ate, ano ko ng competency ko? Oo. Pakikinig dun sa, sa auditorium. Mga 20. Back to back po ha. Back to back na lang, black and white. Thank you. Ate Del? Okay na. Yes. Yes. Comment naman kayo para makita natin dito. Bigyan naman. Bigyan naman. Pwede mag-thumbs up dyan. Thumbs up. At gawin nyo ng blue para at least makita natin. Ganda kayo sa taas? Nag-attend na kayo? Where no? You didn't attend yet, ha? You have a schedule. Yeah, you have. Yeah. Correct. Correct. Ayaw nila. Ayaw nilang ipakita. Ayaw nilang malaman kung sino sila. Ganun ba yun? Ay. Ba't kayo ng ano? Alas dos? Yeah. Yes. Two. Kasi tapos. Kasi sinabi ko na. Gulat ako. Oy, after 2 weeks. Tsaka sabi ko, 2 weeks. Hindi ka masama, di ba? Kung kapagkakitaan natin to. Hindi po. Meron. Ang watch hours dapat ano, 4,000. Eh, ngayon, wala pa akong 200. Ganon kahirap siya. Kaya, watch na. Parang upload ako. Kaya nga, nagulat din ako eh. Medyo mabilis siya. Okay naman eh. Ito nga, magka-COVID nga ako eh. tagal naman nila. Ang slot ko. Anong oras na naman tayo matatapos? Mas 4. Nag-extend man ako everyday.
Paano pag hindi natapos sa revalida?
Kaya kunwari yung mga hindi natapos, pupunta sila sa akin ng umaga. Nag-set ako ulit tomorrow, starting tomorrow at 9. Dito na agad ako. Papakompetensin na ako ng 9. Pero lecture ako ng 2 hanggang 3. Competency 3 to 4. Sagaran. Walang break. Narinig siya. Ano siya? Delayed telecast. Uy, may 1 na. Sino yung 8 to? Yung 8 nanonood. Para sa mga staff na gustong umattend. Yes, kunwari. Kahit minsan yung ibang nag-attend na, gusto pa nila, hindi, sabi ko, competency ka na. Mag-memorize pa daw. Di attend ka na lang ulit. Kaya nga, dito sa 7 nanonood sila ko, hindi ko malalaman, pero sana pwede silang mag-comment para malaman. Those who are here, they can drop their comments. So at least we know who are watching us right now. Hello. You're losing weight, no? Nag-gain na? After losing? Or baka dahil tumabi ka lang sa... Ay, wala akong sinasabi. Tsaka yung 5 nandito, baka pwede naman. Baka pa-thumbs up naman dyan. Bigyan naman. So hindi pa tapos yung lecture ng isang sinundan natin dito sa auditorium. The lecture is still not finished, so we're waiting for them to be finished before we can proceed with our presentation. Ito siya, diyan mo siya. All of you attended the lecture? All of you finished the competency? Yes, you can attend, no problem. No problem. You can attend. Thursday. Social distancing, 1 feet apart. Sure. We're still waiting for the other units to attend with us. Maginaw ba? Ba't parang medyo panginig na ako? Kinakabahan ba ako? Sabay yan. Ito yung pagkain ko lang dito sa bulsa ko. Hindi pa nakainom. Ikaw nakainom mula umaga. Ha? Ang fasting, pero hindi dapat. Hindi dapat, pero parang nag-fasting na ako. Yaya Loyola. Present. Si Yaya Loyola. Kailangan yung present, naka-ano rin yan, nakatapos na. Kayo baka gusto nyo tumama sa announcement.
Nakasampan ko na sa baba.
Naka-live ng YouTube. Sure ba yan? Ayun o, 5 yung nag-watch, pero dalawa lang naka-live. Sino kaya yan? Baka sa siya yan. Hello, welcome. Welcome everyone. So, ER, do you have ER here? Yes, OPD. We don't have from OPD. Do we have anyone from ICU, LMD, OR? We have also from. Mute ito. Baka hindi marinig. Ay, ito pala yung imong yun. Teddy Award. Award. Yes. Social distancing, 1 feet apart. 1 feet apart. Ganito yung tsura. Kasi nung mga nakaraan, walang ganito, hindi ko na i-share yung screen ko, kaya ang labo nila nakikita na. Hindi nila nakikita. See? Naman ako ng brief. Okay. We'll just wait for a few more minutes. Naman lang konti pa. Tapos kita. Diba? So, lahat, everyone, open. Open your YouTube. Hi. Okay. After this presentation, we will have a competency check off. So I'll check if there will be somebody with me who will help me in the competency, because usually if I start the lecture, I'll finish around 3:15. Then we will proceed to the competency. And usually I'm only finishing 3, 4 for the competency from that time until 4. Or sometimes I'm extending until 4:15, 4:30. So I will check if I have somebody with me. Otherwise, you will come back for the competency. Or if you are on duty, just call my office if you are ready for the competency. It should be within this week. 100% of nursing should finish our competency. This revalidation for COVID-19 and IPC updates. Actually, we initially made this checklist. Then we asked the IPC to confirm it or to approve it. That's the first version of the competency. The one we used with all of you. Then the training revised this competency. They removed some because it has MERS-CoV before. So they removed some of this. This is the second version. Now I modified it again. I added some because there are some guidelines. For example, there because before we will just wait for the IPC to decide if we have this exposure. Should we do NPS? Should we stop duty? Should we be quarantined for 14 days? We don't know. But now we have a guideline about this, so I added this to the competency. So I think we can start with our presentation. With our presentation. So good afternoon, everyone. I am Vir, Nursing Education and Quality Coordinator, and this topic is about COVID-19 updates, including infection prevention and control updates in our hospital. So very important in this guideline, we have to know what is COVID-19. It is the COVID-19 coronavirus disease 2019, which we all know is originated was discovered and identified in December 2019. Now, WHO announced that this is already a pandemic, and because 185 and more countries and territories have this disease, and in the entire world, we have more than 2.41. This is only from Mexico, but for sure, every day we are having increase in this number. 3.4 million cases, active cases, and 239 deaths. But the good news here, there are more cases recovered from this. This number are increasing every day, and we have this is to the hospital. Also, in social media, this past 2 days, we are seeing updates on more than 100,000 number of cases every day. Very important. One of the most important things that we have to know is the case definition of COVID-19. We have two case definitions of COVID-19. COVID-19. First, we have a patient with acute respiratory illness or sudden onset of at least one of the following: fever, cough, shortness of breath, and we have epidemiological link for this. If at least in the 14 days prior to the symptom onset, we have four of the epidemiological links. First, we have to ask the patient, do you have any travel abroad? If before, the triage nurse will ask, have you, did you have any travel to China, to Bahrain, to UAE, to Italy? This is before. But now we are just asking, do you have any travel abroad? Because this is already pandemic. 185 countries and territories have this disease. Second, is the patient or has the patient traveled to any of the high risk areas here in the kingdom? Or is the patient resident of one of the six identified by the Ministry of Health high risk areas here in the kingdom? What are these? First, Riyadh, where we are at the moment, Riyadh, Jeddah, Makkah, Medina, Hatif, and Hufu. So six identified by the MOH. These are the high risk areas in the kingdom. Can you please? This is still vacant. You can go. And also here. And everyone should sign the attendance sheet, please. So this is the second epidemiological link. The third, what is the third? If the patient has any close contact with a confirmed COVID-19 case, please do not sit on the middle chair because we are applying the social distancing aside from the universal masking that we are applying until up to the moment. Okay. Third, does the patient has any close contact with a confirmed case? And number four, is the patient with us working in a healthcare facility or working in a hospital or in a clinic? So these are the four epidemiological links for the first case definition. Again, let's review. First case definition, patient with acute respiratory illness or ARI. It's either fever, cough, or shortness of breath. And within the onset of this, in the 14 days prior to the onset of the symptoms, we have these four epidemiological links. Travel abroad, resident or travel to high-risk areas in the kingdom. Number three, if the patient has close contact with a confirmed case. And number four, working in a healthcare facility. So we have to ask these questions because in the visual triage or respiratory checklist, if we encounter the patient says yes, so we have to underline it and put the score and circle the score. So why are we going to underline as the visual triage? For the nurses in the floor, if they will receive the visual triage form, they will only see in circle for the scores. So how will they know, is this resident of Riyadh or high-risk areas? Is this a healthcare facility worker? Does the patient has any contact with the positive case? So we have to underline to indicate which among these four questions are applicable for the patient. And the visual triage checklist, not only these four, actually it has five. What's the fifth one? This is about the second case definition. The first is ARI, the second is SARI. So these are the adult patients admitted with unexpected SARI or severe acute respiratory illness, either community acquired pneumonia or CAP or hospital acquired pneumonia. So what's the difference between CAP and HAP? So the onset of this is 48 hours after admission. For example, the patient came to ER coughing. Then they decided admit this to the ward. Then before sending it to the ward, they did the X-ray. Then the next day, they found out in the X-ray result this is pneumonia. Is this community or hospital acquired pneumonia? Community acquired. Why? Because this is less than 48 hours of admission because we define hospital acquired infections or hospital acquired pneumonia 48 hours after the admission of the case. These are the case definitions, ARI, then the SARI, with more explanations that we discussed. And then some of the patients are also having gastrointestinal symptoms like diarrhea, nausea, vomiting. So we have to ask if they also have like this. This gastrointestinal symptoms are part of the respiratory triage checklist. And also, what is a confirmed case? This, what we have discussed, are the clinical presentations for a suspected case. So how do we define confirmed case? These are laboratory confirmation. Here, we are doing NPS and we are using RT-PCR as our confirmatory test for COVID-19. Okay, next. We mentioned a while ago, these are the 6 a patient with close contact with a confirmed case. Now, how do we define close contact? So we define close contact. The MOH sent us this updated guidelines. This is having the proximity with the patient within 1.5 meters. So this is how we are doing our physical or social distancing. We have to be away from each other more than 1.5. 1.5 is more Because if within this 1.5, this is defined as close physical contact or close contact with the patient. If the patient is positive and you are within this 1.5 meters, you have this case definition. So they added a time element, not only the proximity, but a time element in a close contact definition. If we are with the patient 20 minutes or more in a closed area in a prolonged period, this is also defined as close contact. Aside from that, being unprotected or without PPEs, like for example, the patient, the positive case coughed on us, okay, or sneeze, or touch the used tissue with the bare hands. So these are also part of the close contact with this procedure. That the patient will undergo the respiratory pathway. So we have two pathways, the regular and the respiratory pathway. The regular, if they have a score of 3, 2, 1, or 0, they will proceed. If they went to our lobby, to our main door, their score is 3, 2, 1, 0, they can proceed to their clinic if they want an appointment. But if they want an appointment, but the score based on the respiratory triage checklist is 4 or more, they will go through the respiratory pathway. What's the instructions to be done, to be given? First, hand hygiene and offer a surgical mask. So they will have this standard precaution of rubbing, which is done how many seconds? 20 to 30 seconds hand rubbing with the proper sequence. So later on, we will do our demonstration of our hand rubbing procedure. Then surgical mask. What then? What's next? A nurse will accompany this patient to the ER door. Okay? They will go outside to the ER door. The security should be there to open, and they will proceed directly to the negative pressure room for doctors or physicians assessment. If they need to have NPS, if they need to be admitted, all the processes will be in that area. Clear? We know that we are putting our patient in the negative pressure room. And if the negative pressure room is not available for admission, we need to put our patients in a single room with HEPA filter. Very good. HEPA filter. HEPA. Does it stands for what? Hepatitis. HEPA. High efficiency particulate air. HEPA filter. This is portable to cover um, the the negative pressure room have its HEPA filter on its own. So if you don't have, we'll put the patient in a single room with HEPA filter. So what? As a nurse, we have to know how to maintain, how to check our negative pressure room. What's the acceptable negative pressure in our negative pressure room? Negative 2.5 and below. Negative 1, acceptable? Yes or no? Think again. Negative 1, acceptable or not? No. Why? Is it the normal is negative 2.5 and below? So negative 1, is it below 2.5? Nalito na. So, so what? Negative 2.5 and below. Negative 5, acceptable? Negative 3, negative 2, no. So negative 2.5 and below, negative 3, negative 4, negative 5, negative 6. All of these are acceptable. If not, if only negative 2, negative 1, we have to report, we have to document, and it has to be followed up that it will be Correct. From the engineering department. So what's the normal temperature acceptable for a negative pressure room? 20 to 24 in the store, just to have a review and not to be confused with the numbers. What is the normal temperature in the store? In your 18? In your store, how about in your store? 20 to 26? How about in your store? 18 to 24? Our stores have different guidelines. Why like this? Every time. These are, I know you nurses don't want numbers, but we have to memorize these numbers. Because if we are checking this, we cannot report it. We don't know if it's correct or not. If we don't know the acceptable range of temperature. Again, the correct answer for the store is 21 to 24. Again, for the negative pressure room, what's the acceptable? 20 to 24. How about in your medication room? 18 to 20. Different answers. We just finished Sibahi and JCI, guys. So we have to maintain this. 18 to 25. Recap. Medication room. 18 to 25. Clear? In the store. 21 to 24. In the negative pressure room. 20 to 24. How about humidity? In the negative pressure room, 20 to 60. How about in the medication room? 30 to 70. Very good. Okay, clear? How about the distance from ceiling to the shelf? A lot of numbers. 50 centimeters from the ceiling to the shelf. From floor to the shelf, 10 centimeters. From the wall to the shelf, 5. Lot of numbers. And what more for medication calculation? Yalla, you will remember this, or if not, you can see this under or below this sheet. Okay? Even in the medication room, even in the store, you can see the normal ranges of acceptable humidity or temperature. Let's leave it here. So now, what is the acceptable? Again, number. Again, number. So we have to remember social distancing 1.5. This is good. But for the patient's bed and patient's chairs in the waiting area, it is 1.2 meters apart in ER, in waiting area, and in the ward. All of this have the same 1.2 meters apart. Easy to understand, easy to remember, correct? In the critical area, multiply it by 2. 2.4. Clear? Okay. Mariam, what's the acceptable distance in ER? 1.2. Frischel, in NICU, what's the acceptable distance between incubators? 2.4. Very good. 2.4 and 1.2. Critical area is 2.4. Next, this is our awareness file number 76. Have you seen this before? Or is it your first time to see this? You saw this in your email, then delete? Saw in the email and then skip? So we have to give time. Okay? Take around 10 seconds to scan at least. We defined this close contact a while ago. Okay, we will leave it with that. Then, for a healthcare worker, we have, for example, exposed to a positive case or a suspected case. We have 3 types of monitoring. Okay, we have first self-monitoring, very self-explanatory. We will monitor ourselves. Okay, So at least 2 times per day, we will take our temperature. Is it only like this? So they should have a thermometer for checking the temperature, and also you will assess yourself. You will monitor your symptoms, ARI symptoms. What is active monitoring? Active monitoring is defined as there is a regular communication. For example, you will be exposed and you are part of the tracing. So maybe someone from the hospital or someone from MOH will call you. Are they calling? Do you have experience of this? If you have been exposed, the MOH staff will call you every day to ask you about your symptoms. Sometimes we will have a group chat in WhatsApp to ask or report daily what are your symptoms. So these are examples of active monitoring. There is a regular communication through this exposed people. And lastly, self-monitoring with delegated supervision. Have you seen the ARI log sheet? This ARI log sheet, the visual triageness is asking this. And before we have this in the units, so we are doing our self-monitoring, we are reporting what are our symptoms, but it has an oversight from the healthcare facility. Yeah. Is it clear? Self-monitoring, active monitoring, is the staff develop a symptom. Will he or she immediately stop duty? Or, for example, I will not go to duty, I have symptoms. So it has to be reassessed by a physician. Then they will give you the disposition. Will you stop work? Do you need NPS? Or unless it's regular, you will just continue your duty. So answer, if the healthcare worker or nurse develop a symptom, they have to be reassessed by a physician. So for this, no, you, Marisa, Marisa and Odessa. Ah, I thought it's you. Okay. So the frontliners with the overall. But they said the overall now is not recommended. That's why we cannot see this now, and we are only wearing the gown, gloves, and 95. And even the face shield is not part of the MOH recommendation in our tanning and dumping of our PPEs. Later on, we will see the latest update on the isolation signs and what are the PPEs used in each. You will not see there the face shield. The PPE or not. This in these scenarios we will know, are we high risk, medium risk, or low risk, and what will be the management for this if we have been exposed to a patient without PPE and we don't have PPE. This is high risk exposure. We have to be monitored actively, and the management stop duty, do NPS, and you will be quarantined or not go from to work after 14 days of exposure. You are not wearing your mask. The patient not wearing his mask. This is high risk exposure. Active monitoring. We should stop our duty, do NPS, and exclude from work after 14 days. What I'm saying? High risk. So this is the second scenario here. The patient is not wearing a mask, but wearing a mask. You not wearing your mask or PPE. This is high risk exposure. Active monitoring, stop work, uh, you do NPS and to be excluded from work 14 days after the exposure. Okay? If the patient is not wearing is wearing a mask, the patient is wearing a mask, and the patient wearing a mask, medium risk. I will better use my own. Okay, I don't have my dental pen, but I hope we will benefit from this. Okay, this is the patient, and this is the healthcare worker. Okay, if the patient is not wearing a mask, you are not wearing your mask. What is this? High risk. What's the management? Stop duty, do NPS, and you will be isolated for 14 days before you come back to work. If the patient is wearing a mask, check. The nurse not wearing a mask, what's this? Medium risk. What will be the management? Stop work, do NPS, resume work after negative result. If the nurse is wearing a mask, the patient not wearing a mask, what is this? Low. If both of you wearing a mask, this is also low risk. Is it clear? If you will notice, if the nurse is wearing a mask, universal masking, so every time it will be low. But if the nurse is not wearing a mask, then the next question is the patient wearing it or not? If not, high risk. If the patient wearing it, medium risk. So all high risk will have the same management. Stop work, NPS, exclude from work 14 days after the exposure. Medium risk, stop work, NPS, resume after negative result. Then low risk, continue your duty, no need for NPS. Is it clear? Let's just check what are the additional scenarios that this guideline is telling us. Okay, so the patient here is wearing a mask. If the nurse not wearing eye protection, no face shield, not wearing gown and gloves. Okay, but the nurse is wearing a mask. Wearing a mask without face shield, without gown and gloves. So as I mentioned, this will be low. If there is AGP, aerosol generating procedure, like nebulization, suctioning, CPR, intubation, bronchoscopy, those procedures which may generate aerosols, we have to wear N95 and additional we can add face shield. Okay? What if the nurse is wearing a face mask instead of N95? This is still low risk. Protected, meaning full PPE with the mask. Even if the patient is wearing a mask, these are low risk of exposures. Clear? You will do extensive body contact with the patient, like what? Jambi, or you will do bed bath for the patient. Extensive body contact. You should wear gown and gloves. Okay, but if you will not wear this will be medium risk. But all of us or all of the nurses are going, if it's contact precaution, we are going there to deal with the patient with this extensive body contact procedures. We will wear gown and gloves. will the healthcare workers who have been tested positive will be considered clear from this COVID-19? We have three criteria, okay? Three criteria, all should be met. I will just tell a story. Sorry. Is there anyone who have been positive before with us right now? So he or she can attest the story. Okay. Once a staff or a person will have positive results, the MOH or the hospital will call them and somebody will fetch them from there by ambulance and they will be brought to the government facility quarantine, which is like a hotel. They will be in a single room and all their things will be provided for them. They need, the first criteria, they need to have two negative results before being discharged from that government facility. Aside from that, can they go? Now, can they go for duty after two negative results? No, they have to go for a 14 days quarantine in another facility. And in our case, our hospital provided Nasim accommodation for this 14 days quarantine period. Now we have two. First, two negative PCR results. Second, you have to finish 14 days quarantine and before going for duty or before being cleared from COVID-19, at least 48 hours they have to be asymptomatic. Clear? Again, two negative results, 14 days quarantine, at least 48 hours asymptomatic. Is it clear? Okay, now we have to know what is the transmission precaution of COVID-19 because what's the relevance of knowing the transmission precaution? For us to know what are the PPEs we have to wear and how we will deal with this disease. Based on the policy, the COVID-19 transmission precaution is contact and droplet with airborne precaution if applicable. Delete this. They updated it. Again, now, what should be remembered? In our hospital, our IPC team provided more cautious decision. The transmission precaution in our hospital for COVID-19 is contact and airborne. Again, for all, contact and airborne. Okay? So we have to know what's the next step. What are the PPEs we have to wear? So we have new guidelines for just now. Is it new in your eyes? New for your eyes? Okay, we have to tackle this very carefully. Color coding change. And the PPE to be used also changed. But in contact, it is the same. Gown and gloves. The color coding, if before it is red, now it is green. Green grass OPD, OR. Green OR. They have contact precaution. Clear? Green contact precaution. What are the PPEs? Gown and gloves. So we have to practice hand hygiene. Before leaving the room, we have to remove it and drop in the yellow bin, medical waste. Next. Before it's blue, but now we have to remember droplet is color red. So what is the PPE for droplet precaution? Now only surgical mask. Only surgical mask. Okay, again, for contact precaution, color green, what are the PPEs? Gown and gloves. For droplet precaution, what are the PPEs? Surgical mask. What is the color? Red. Clear? Where are we going to remove our surgical mask when we are in the patient room? Inside the room before leaving the door. There. Yeah? So we have to remove this. How about for airborne precaution? What is the color now? This is the color blue. And what is the PPE? Only N95. Oh, okay. Only N95. So when are we going to remove N95? If the room is a regular room, single room, we have to remove it outside after closing the door. Floor, we can find yellow beans outside the door. Did you see that? Did you notice that? Of course not, because you're not going there. Okay, so in other floors like pediatrics, do you have yellow beans outside? In male ward, do you have yellow beans outside? Nothing now because we are removing our PPEs inside, and only in fourth floor they are using N95 because they are receiving the suspected and confirmed cases. And COVID-19, if suspected or confirmed, this is contact and airborne precaution. So COVID-19, what are the PPEs? Gown, gloves, and N95. So why there's no face shield? This is not a recommendation anymore. We will use the face shield whenever it's applicable, when in aerosol generating procedures. Clear? Any question? Okay, now we have to proceed with what? Gown, gloves, and N95. Gown and gloves because it's contact precaution. N95 because this is airborne precaution. So if you will do an aerosol generating procedure, those who will be exposed there should wear the PPE for this aerosol generating procedures, like N95 and face shield. Another example, if you in the floor in pediatrics, in male ward, you will go inside the patient room for nebulization, for suctioning. What will you wear? N95 and face shield. We have a comment on this before. The nurse went there, just surgical mask. Although this will be a low risk, like what we have discussed, because you are wearing surgical mask, based on the guideline, if we will do aerosol generating procedures, we have to protect more ourselves. Okay, protect ourselves more. N95 and face shield. If you need gown and gloves based on your procedure, you have to wear it. If we will transport a patient, if this is now, I will not talk about COVID-19 initially. I will first talk about a patient under contact precaution. Okay, we said contact precaution is color green, droplet color, and airborne color. Very good. So now we will transport the patient with contact under contact precaution. So how are we going to do this? First, communicate or notify the receiving unit. Okay, notify the receiving unit. Second, what will you tell? What's the diagnosis? What is the precaution or isolation precaution for this patient? Next, we have to notify the security and the housekeeping. What's the role of the housekeeping? To clean the area, the pathway. What is the role of the security? Limit the crowd control. Okay, very important because if you will if you will push for admission, for example, a positive case, no one should be like going like this, and you are pushing the stretcher, and the people are just like this. You should also bring with you the transportation card. This will guide you what are the steps. This is the transportation card. And also, if other people will see this with you while you are transporting this patient, they will be notified. They will be aware if they saw this. This is color green. I know this is a patient under contact precaution. Next, if the patient is contact precaution, for example, the patient has wound, okay, we have to do the dressing imperviously. What do you mean by imperviously? Big word. Just do a good dressing. Good. Just do a dressing which will not have any leakage. Okay? So, proper dressing. And what else? The patient should wear a clean gown and you have to cover the patient clean sheet. And then you have to do hand hygiene and do the disinfection of the bed, disinfection of the wheelchair if you use wheelchair after the procedure. Is it clear? We will transport this case to the floor. Again, first notify the receiving unit, notify the security, notify the housekeeping before going. They have to be with you. Next, if the patient can tolerate mask, give the patient a mask, surgical mask. But if the patient cannot tolerate it, for example, difficulty of breathing, like this, so kalas, don't give them a mask, but the nurse should wear a mask, okay, surgical mask. And we have to teach the patient about the cup etiquette. We have to do the proper hand hygiene and disinfectant after the procedure. What's the acceptable disinfectant in a hospital? Surfasafe. We still have Unisepta? No more. So we have now Unicep. Surfasafe. Yes. Yes. Surfasafe. This is the same thing, notify the receiving unit, notify the housekeeping, notify the security, how to prepare the patient. If they can tolerate mask, you will give the patient surgical mask. Okay? And if the patient cannot tolerate surgical mask, the nurse will wear N95. All sign the attendance sheet. Okay. The nurse will wear N95. You have a question? Attendance sheet. Okay. Questions and do the disinfection. Who among you have valid negative, valid fit test? Valid. What's the validity? How many years? 2 years. For the fit test have validity date? Because in the policy, I said this is 2 years validity. Meaning, maybe during that time, but how? This came from where? IPC? What size? Have to check before it's only 1 year, but then after I think Sirhan, they did 2 years. Okay, to extend the renewal. No, so it was in the policy. Based on the policy, it is 2 years. So we have to check this. Why it's like this? Maybe they will change it because we have to have the same answer. If I will ask you, what's the normal temperature in the medication room? Will we have the same answer now? What's the normal temperature in the medication room? I heard 19. I heard, what is this? If we, why we're doing this, I will just tell you. Why I'm doing this? Because this has been done before. Remember? This has been discussed in your in-service. We did our sessions before. I did competency with you, with the supervisor, with the head nurses before. Few months ago. Why we are doing this? Because there are some comments that the internal audit, quality, IPC, or the management going to the units and asking the nurses and they cannot answer properly. So if we did our educational sessions, if we did our reminders, so where are we looking at? The knowledge has been given. Skills for the dunning and doffing, for the hand hygiene, for other infection control guidelines has been given. So we are now pertaining to the attitude part, to the commitment, okay, of the staff to comply. It's very important. If we know knowledge, if we know how to do it, to perform it, skills. But, kalas, nobody's looking at me. Nobody will say, I'm just inside the room, no camera. I'll just look. So this is the attitude in complying our protocols. So remember, infection control is very important because this is not only for the patients, but this is your protection. We don't want more positive cases, for example. We don't want more violation and there will have somebody who will get sick because of needle stick, for example, or any other communicable diseases. These are for us. But for an infectious case, if the patient discharged or died, we have to do terminal cleaning. So who is responsible for terminal cleaning? Housekeeping and the nurse. So we will not say terminal cleaning is only for housekeeping, but why we have for housekeeping is also for all these time and make sure that the patient is accurate. Okay? What they are using for cleaning? Anios is disinfectant. Terminal cleaning needs more specialized agents like powder detergent and Clorox. What are you doing right now? Or Bono. They can use powder detergent and the Clorox. Why am I discussing this to you? Why am I you that they will do or clean the ceiling first? So this is the scenario. Once the patient discharged, this comes the patient's responsibility. What's the nurse's responsibility? Sorry, the nurse will remove the linen. Next, remove the equipment, disinfect. Then the housekeeping will be notified. The housekeeping will come. They will remove the garbages. They will do what's this? Disinfecting the most touched areas like the knob, like the cabinets, or like this. And they will do the terminal cleaning starting from the ceiling. then the walls, then the floors. And usually they are taking 1 hour to 1.5 to do this. Why it's taking time? Because they will prepare for the solution for the ceiling. They will use 5 liters water and half of the bottle of Clorox. Okay. Then on the walls, they will have another basket for cleaning the wall. They will use 5 liters water and half Clorox. Then after that, they will prepare their 3 baskets, blue, red, and yellow basket for the first, second, and third mopping. They will use 10 liters of water plus the powder detergent for the first mopping. For the second mopping, only water for all. Third mopping, 10 liters water and 1 bottle of Clorox. It will take 1 hour to 1.5. That's why if you have a patient discharge and in the ER, why they're still not finished? Why were the housekeeping? We have to consider that this is the duration of their terminal cleaning. Why we need a room? The patient is now shouting. The doctor is pushed to the floor. Why we don't have a room? They're still preparing. Why it's taking too long? So we are part of the terminal cleaning process. As nurses, or especially the assigned and the charge, should supervise. And now I saw that there are additional papers for supervising the housekeeping job. Have you seen this? Have you seen this checklist? So you better be aware that we have this additional checklist. So as nurses, we will supervise, monitor that these are the processes they have to perform. Why? It's their job, but it's also our task because we are going inside the room. Patients will come in the room, so we have to make sure the terminal cleaning process has been done properly. Okay, so why I'm teaching this? Because we have to know, and you will observe. Okay, they're doing like this. If they may have different, so it has to be asked why. Is it allowed, or they are just making their own way of mixing the solution? Okay. Next question. That's the next slide that I'm going to go. Okay. Yes, for sure. Don't use your bare hands as being to place Sankalas. The patient discharge has a diagnosis of airborne or like this. So you have to wear the PPE. The allowed PPE for this. This is the case. Okay. Protecting and priority here. Protecting our patient and ourselves. Okay. Now, next step, the fumigation. Thank you so much. We have fumigation machines. We have old and new machine. The old is the smaller one, and the new one is the Aerostat 500, the new machine. The difference, aside from the size, is the price, the contact time. The time, if they started at 2 o'clock, the old machine, you can enter the room after 40 minutes. Yes. The new machine, it's taking 3 hours before you can use the room. Yes. So both of them are using hydrogen peroxide 6% H2O2, but the new machine is requiring more. So usually the biomed is the responsible people in doing this at this crisis period. Because before, who is doing this? Infection control. But this crisis period, the biomed is assigned to do this. Are they only two to do this? They also trained some of our supervisors. So not anyone can just ask the biomed, I need the fumigation in this room. Because there's a process. Have you seen this before? Yes, in Delhi. Have you read this before? Really? That's the process there. Very DMT. IPC will provide the list of the room to the biomed. Terminal cleaning should be done before the fumigation. This is a requirement for fumigation. It has to be terminal cleaning. You have to do with the proper cleaning. you smell the fumigation, the hydrogen peroxide before, it's very strong. So we cannot really go inside if we have this. Any question for any of this that we have discussed? Is it clear? Am I explaining it clearly or next is the prevention of our close your eyes. Follow instructions not to be heard. Okay. So can I invite Marite? Now I'm correct. Because I think the first day or the second day, Sherdella is here, and I called her Marite. I have difficulty with the names, in identifying the person like Audrey and Marjorie. Until now, I cannot identify who is Marjorie and who is Audrey. Yeah, I have this. I don't know what's the syndrome, but I have this syndrome. Marite, Suja, Eliza, please come forward. We will do hand hygiene. So you will observe how they will do it. Do you have a card? Do you have the card for hand hygiene? The new one? No. We have new. We have here, but only few. Very limited. Again, okay. Let's observe. Then,
Charm you do. Talaga? Ay! Ay! Hindi na pala? Ay, ganito na. Kaya nga. Ay, ganito. Tingnan mo. Wala na tuloy ako. Di ba? Wala na to. Ganyan na lang. Ay, ito na yung last. Sige, sige. Ay, yes. Kasi ako lang yung
Oo, ito. What are the 5 moments of hand hygiene? Congratulations, very good. I'm Hernando. Okay, thank you so much. Now, how are we going to wear our PPE? Well, volunteer. Volunteer to wear the PPE. Anyone? Ella. Uy, Ella, who will wear the PPE? Ella, Tuja, you want card? One more. One more. Who wants to start the competency after this? Because maybe it's already 3:20. So I will finish maybe around only two. So who are the two? Lucky two. Two fish and fisher. Come on. Do the learning. Because later in the competency we will do. So now is the time. Who are Ella? So what's the first step? Okay. What will be the first thing to be worn? Gown. Okay. What's the second? Gown. Hat. Glove. One cup. One cup. One cup. Now we are having so you guys we are using mathematics. Okay. You are wearing it. You have to make sure it's dry. When are we discarding our have you watched the video of telling it happening? With your helmet, the video? Let me you watch it? There's some what the video, but it was sent to you. You watch it? You don't have YouTube, huh? You have YouTube? Open it and watch it. Then like it. Did he do the correct yes? Okay. So with this. So very important tip, and we know all this, but we can do it. Okay, now again, that is God, love, occupation, God, and love. Okay, what's up? Is airborne. Now removing. What will be the first to remove? The dirtiest, the most contaminated part of our gloves. The last glove. Then directly you have to dispose for your toes in bin. Now, you don't have to dispose. Now, what will be removed? I feel. You don't have I feel now. Down. Remove down. Is it allowed here? No. You didn't? Who said it's not allowed to tear? Raise your hand. Where are your hands? You just mentioned that's allowed. Don't explain. I'm asking. Who is saying not allowed to tear? Raise your hand. Let me see your hand. Not allowed to tear. It's not to be unkind. Yeah. Who said not allowed to tear? One, two, three, four, five. Allowed. So meaning for you is okay to tear? Alright. Can we tear it or not? So all of you are saying no. Can I see the hands? Who are saying not allowed to tear? Let me see your hand. Allowed? 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 No. Allowed? No. No. Adonna allowed? Only Adonna and Charmaine? And Marjorie? For you, allowed or not? If your hands are small, are short, see, I'm asking a while ago, you are saying all of you watch it. Now we will see if you really watch or not. I will show you the video. Because you said that's allowed. Later. Remove it now. If you have like, so how you will remove it? Who wants to join them? Ella? Here? Join. Because I will ask you, in the video,
No. No.
I will know hello? Yes. 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 Okay. Where are we right now? Finish for Suja? Yes. For Dora, who wants to be with her? One more. Any volunteer? Or else we will just sing song. Among the roses. Ayan. Thank you so much. Okay, now take care. What's the first one? Go. Now, Suja, take care. So no one of you watch the video. And Fabian sent to you. ER sent to you. The video from there. Okay. Did you feel like it? Yeah. Who wants to have that moment? Okay. Okay. What will be the first thing you do? And now remove it properly. And maintain it with your hand. Because in your hand, take it properly. Then you start to yellow will remove left. One will remove. Totally okay. Properly. Then remove your. If we are doing that, something. I will take more from. She will take one. Social distancing. you are trying to give it to the head nurses, so you will receive a copy of your card. Okay? If you didn't receive this until after 2 days, tell your head nurses. Deficiency from my side. Okay, next. When are we going to move or discard or dispose our sharp containers? 3/4 or when odor arrives. Huh? No more days. No more 7 days. No more 14 days. We have only 2 days. We're considering when odor arrives or there's already 3/4 full. Or if it's contaminated, for sure, it has to be replaced. So you can have your own observation. We are all responsible for infection control, for safety. If you saw in the unit it's already more than 3/4, if you saw that your shop's container is just on the floor, it's not really fixed to the wall, for example. So you can report this to your head nurse. Don't wait for anyone who will do the rounds and find out a lot of things in your unit. To help your unit be the link of your unit about infection control. All of us are responsible. Although we have IPC links in the unit, but we can be advocate for our own unit. So we have to do this. Our if our hand is short again, and if you, for example, bodybuilders, any questions? Because this is the end of my presentation, we will proceed to the competency check-off. Anu, when you go to the podium, you cannot hear the voice very low. This is 2:20 after 1 hour and 20 minutes. So I should be here every time. When do curtains be changed? 6 months. If it's blue, disposable, it's 2 weeks, 14 days if it's the washable. Or it's soiled, visibly soiled, infected, patient discharge. It has to be changed. You don't know about this? I sent this weeks ago in the leaders group. Maybe some head nurses are not sending to their WhatsApp groups all the updates that we are sending. Okay, good. Any other questions? Who wants to start the competency? Suja or anyone wants to start? Or Prichelle? Huh? The questions are these competencies. Do you want to get and review, and whenever you can go, just call first before coming to the office, so make sure that I am available. Get one and pass, then return the other excess competencies. So now, who will start? Do you have any volunteer? Let's see here. Yeah. Fritzy, are you still there? So you cannot hear the voice if I'm in the podium. So next time, so tomorrow, if I will do this, I'll stay here and I should have the pointer to, because I'm just going there to change the slide, to press next. I'm not even looking at my slide. Anyway, slides are for you. Are you? Yes. So you can sign the competency education given by me, Vir Angello Dial. The date is today. I will sign it. Then staff acknowledgement. You acknowledge that you received this training from me. Then at the back of this sheet, on the bottom part, name of staff. Put your name, your signature, and don't put the date because this date will be for the competency date. And evaluator will be blank because it may be some of nurses or supervisor or me. Okay. So now, who wants to start? Volunteer, yalla. It's already 3:46. All of us wants to go. Yung ano, yalla. Do you want to face the audience or face the wall? Yeah, it's one on one. Between you and me only. Yalla. You can stay there. No, because be the instrument of learning. Yes. They will listen to your answers. Maybe they can get pointers. How to answer these questions, diba? Yeah. Confidence is the key. If somebody will go to your unit and ask you about this, be confident in answering them. So this is a good chance for you because in the rounds, you don't know who is with the rounds. It may be with Dr. Fahad, with Miss Abir, with Dr. Dalia, with Al Harbi, with the medical director. We don't know who are going to the rounds. So better to be having this practice in front of our colleagues. It's just us. Me too, I'm having this fear of talking. So I'm trying to just make my face thick. Translate what I've said. Headache. So I'm just trying to gather my confidence. Okay, facing our fear is one of our goals to be achieved, inshallah. Okay, inspirational. Yalla. Fritzy, are you still there? Anop, are you still there? Anop, are you there? Can you help me here, please? I will ask if any head nurse is available to help me. Okay, yalla. Let's start. While waiting for a head nurse to come, Anop, if you're still there, please come and click the thumbs up. Fritzy and Anop, click the thumbs up. Okay, sure. You can go. You have to start the You have to give me everything. Okay. So Yes. Okay, if you want to listen to the answers, this is how we will do our competency. So the competency will just be asking these questions, or I may ask additional questions outside of this, but all these are beneficial, good to know. Okay, now, Anna,
Yes, sir.
what are the case definitions of COVID-19?
So we can translation. First, the patient first how SOP in between 40 days prior to yes, within the day follow. The history of given in a heat and visited in a visited or worked in a healthcare facility or COVID and or working for a healthcare worker uh, very close contact with patients who are on COVID and for adult patients who are admitted with so this second system is first case to meet the medical isa pa rin
Got to tell more? Thank you so much. Where are the high-risk areas in the kingdom? Again, Katir, Pupo, Jeddah, Medina. So, ang ganda ng intro eh. Next, what are the components of the respiratory threats checklist? Two components. The first and the second, what are they? What can you find here? What can you see? What are the components of the respiratory threats checklist?
we have the you mean the
Yes, exposure risk.
exposure risk
And
then physical manifestation.
yes. What is the score to have a pathway of the respiratory pathway?
Equal to or
So what is the pathway? What will be the instructions and how it will be done?
this patient will be instructed to do hand hygiene and let them welcome and then accompany them to passing the outside one.
Very good. Very good. What is the transmission precaution of suspected and confirmed COVID-19?
For suspected and confirmed COVID-19, we are applying contact and
Okay. So who will be with ano? So, oh, anyone can have his or her competency with ano? Okay, next. What are the PPEs for this 19? If you have EGPs, what are the examples of EGPs? Where should it be done? What is the precaution? Anyone? Who will go to Mr. Ano? Yeah, that's okay. Who wants? I will select because everyone should do it. Anna. Anna. Annalisa, yes. The priority is female ward. When you're handling these cases, you have to be strict with Anna. Next is Alisa. Fifth floor. Third floor? You don't have a mouse. Anyone fourth floor? Only Annalisa. Where should it be done? What precautions? Okay. If you have a patient in ER, what should be the acceptable distance between them?
For ER,
1.5. Again, ER in the ward,
the word
in the waiting area,
waiting area,
in the ER.
1.5. In the bed,
Yes. 1.2. We only, oh, your label is wrong. The, we said a while ago, social distance 1.5, but the patient distance between each other, you only have two numbers, 1.2 and 2.4. Critical units, waiting area. You will transport a patient from your unit to another unit. COVID-19 positive case. How are you going to do this?
looking for the CIU ward to prepare for the duty guard for the
So what are the PPEs you will wear if you will transport COVID patient? Only wrong. Because this COVID-19 is contact and airborne. So transporting patients with contact precaution is we are wearing gloves. Only gloves? Don't count. We just finished, guys. Transportation. Transportation of patients. Contact, gloves. Only. Airborne, airborne, N95 if the patient can tolerate it. Okay. If the patient is COVID patient, so COVID is contact and airborne. So if the patient is in the room and we will go inside the room, the precaution is based on the isolation sign. Contact is gown and gloves. Airborne N95. If we will transport, contact is only gloves. Airborne is N95. So you will transport the patient COVID-19, gloves, and N95. But you will give the patient surgical mask if he can tolerate it. Otherwise, if he cannot tolerate, you will wear N95. Hmm? Yes. If the patient can tolerate it, the patient will wear surgical mask. If she cannot, you will wear N95. Question? Yes. Okay. So this is the relevance also of the competency. We are all learning again. So I am assessing if you understand. You will don't forget to be if your business for transport, you have to have with you the card. You have to notify receiving, housekeeping, security. What is the cleaning time that we're doing in the room for isolation? What is your role? Do you have a role?
yeah, as a nurse, chef and supervisor. We should super
Yes. What else? What are the agents used for Yola? You know Yola? Yola is there. Yola. Limo. Agent, what are the agents used for the What do you mean by prolonged close contact?
more than 20 minutes.
1.5, within 1.5 meters, or you are unprotected, patient cuffed on you like this. If your patient is wearing a mask, you are not wearing your mask, what is the risk? Patient wearing it, you are not wearing the mask. Are you sure? So, patient is wearing. Okay. For those of you who will not finish the competency today, we will do it tomorrow and the succeeding days, not more than Thursday. Okay, so you have to, if you're on duty or whenever you will be free, call and I will tell you if you can come or what time or somebody will be getting your competency. Yes, my duty is until 4 p.m. but 2 to 4 I'm here. At 9 to 10 also I'm here. 9 to 10 in the morning. Oh, binaman niya. Ang nangyari na ko. That's why if you don't have availability, tell so it will be communicated with me. So the head nurse or supervisor will do it for you. Okay? Kung nandyan si Yola, nandiyan ka pa ba Yola? Thumbs up naman dyan. Okay naman.
Like and subscribe.
Okay. Medium. So what's the management for medium is? What's the management? Wrong. Medium risk, you have to stop work, do NPS, and return after negative result. Not met. If your patient is wearing a mask, you are wearing your mask, but still, if your patient not wearing a mask, you are wearing your mask. What's the management for those? Continue, do you need NPS? If both of you, patient and the nurse, not wearing a mask, high risk, what would be the management? Wrong. It has to be 14 days quarantine after the exposure. Okay. If the healthcare worker gets a symptom, develop a symptom, what should be done? Okay. So those who are positive before, what are the criteria for them to be cleared from COVID? Yes. Okay. What are the types of hand hygiene? Duration, 5 moments of hand hygiene. Uh, PPEs. What's the PPE for droplet precaution? Airborne, contact, sequence of planning for PPE, removing, where will you remove your N95? Huh? Then, Anti-Rome? Anti-Rome or asbestos? When will you dispose traps container? Curtains, disposable, washable. What's physical distancing?
1.5.
If you will be assigned in the ward, when will you put your name in the healthcare worker contact with infectious disease? Every day. Okay. Do you have calculator? Calculator. 1, 2, 3, 4, 5, 30. Ah, 30 times 2, 60, 61, 62, 63. 63 over 70 divided by 70. Yeah. Times 100. Ilan? 90%. Okay naman. Next, what's next? Ilan? Pero, sino ang fourth floor dito? Fourth floor. Okay, go. For only one for ano, then we will go. So if you want to listen, it's okay. But if you don't want, you're free to go. What are what's that? What are the relax yourself. What are the definitions of COVID-19? Okay. Physiological name. What do you mean by close contact? Sabi mo pala yun. Yeah. That's for me. You can go, you're free to go, or ano? Yes. Pero, kayo yung mga last batch, no? Tapos ito, ulit na lang. Ay, ano ka na? Okay. Thank you so much for attending. And we will just continue this competency. And that's it. Where are the high-risk areas in the kingdom? How do we define different cases? There's a laboratory confirmation. Respiratory triage checklist components. Clinical symptoms and exposure risk. What's the score? So if 4 or above, what will be the instructions and what's the pathway? What's the transmission precaution of COVID-19? What's the PPE for COVID-19? Patients between in ER, what's the acceptable distance between them? Ward, critical area, waiting area, EGPs, where and what are the precautions? Where to be done? Where to be where to you transport a patient COVID-19, what will be the process? What will you wear? What's your PPE? And bring your transport card. It's alright for OR, only small. But this card is A4 size. Yeah, big card. After patient discharge, what will be the procedure? Terminal cleaning should be done. Who is responsible in terminal cleaning? What's your role as a nurse in terminal cleaning? What are the agents used for terminal cleaning? What do you mean by prolonged close contact? If your patient if your patient is not wearing a mask and you are not wearing your mask, what's this risk? High risk. So what will be the management? Very good. If your again wait the patient is wearing a mask, you are not wearing your mask. What is the risk? What is that? Only one. I will read it for you. Tap of fingers to opposing palm with finger interlock. We have vice versa in dorsum and rotational and fingertips. Huh? But this one is alone. We have three. We have three steps with vice versa. Palm to dorsum, vice versa. What else? Rotation of the fingers, of the thumb and fingertips. So three. But the interlock is alone based on this guideline, and the rest removed based on the guideline. Next, patient wearing a mask. The nurse not wearing a mask. What's this? Wrong. Medium. Correct. Very good yun. Pero ito, mali. What's the management for medium risk? Very good. Your patient is not wearing a mask. You are wearing your mask. Both of you wearing mask. So, what's the management for low risk? Continue duty and no need NPM and have a life. Have a good life, but still with social distancing. If the staff have a symptoms or develop a symptom, what will be done? If you develop any symptoms, so what should be done? Okay. So when will those who have positive results be uh, cleared from COVID-19? Two negative results, 14 days observation period, at least 48 hours asymptomatic. Very good. What are the types of hand hygiene? How many seconds? Hand rubbing, hand washing. 5 moments of hand hygiene. Before touching the patient, before doing a septic technique, after after body fluid exposure, yes. After touching the patient, after touching the environment. That's partially PPE for contact precaution. Airborne running sequence. Removing. Surgical mask. Where will you remove surgical mask? N95. Sharps container when to remove. Again. Three-fourths. Curtains. Blue. What social distancing? Physical distancing. You will be in the floor. You will contact with the patient. When will you enter your name in the healthcare worker with contact with infectious? Your calculator. One, one, two, three. I think it's 95.7. 35, 35 minus 3 times 2 plus 3 divided by 7 times 100. Malinaw. 33, 35 minus 3 minus 3 times 2 plus plus 3 divided by 17. What? What time your duty? Yeah, tomorrow. Kulang lang ako ng buwan eh. Time. Time. So 95.7. 1, 2, 98. Yeah. Yeah. Bukas na lang daw kasi uwi rin kami. Kasi may nakaabang dito ang ano, oh. Nandiyan pa ba si ano nakaabang? Oo. Late ako ah. Late ako, dito ako ah. Competency lang to ah.
Thank you po.
Thank you so much, guys. Oo, yung ate mo. Sino pang nandito ngayon? Sino pang nandito po sa loob? Who are still here with us? Po, can you can you leave a comment? Hello, Jess Fernandez. How are you? Pagkatapos ko lang mag-lecture ng COVID-19. Stop sharing. Ayun na nga. Sana naman yung mga nandyan pa. Yola, andyan ka pa ba? Abigail, Fritzy, Anoop, andyan pa ba kayo? Kung nandyan pa kayo, patamsak naman dyan. Tamsak, thumbs up. Jess Fernandez. Patamsak naman dyan. Where is the love? Yes, sir. Fritzy, maliwanag ba yung ano, yung audio or tulad nung sinabi ni Anok kanina na kapag malayo na ako hindi na marinig? Or depende? Yes, sir. Thumbs up naman dyan. And everything. Maliwanag ba, Fritzy? Abi, nandiyan ka pa? Miss Abigail? Yeye Loyola? Anoop, andyan ka pa? Anoop, are you still there? Yola, Ate Yola, are you still there? Or you left? We still have 5 people here. Yes, sir, pag malayo po, mahina. So, next time, so starting tomorrow, hindi ko nalalayuan tong laptop. Dito na lang ako sa harapan ng laptop. Pero nakikita mo naman yung slide, di ba? So, parang okay din. Kasi yung mga previous days, ano ganyan lang. Yung script, yung power, yung projector lang yung nakikita. Kaya, hindi ko masyadong naisip. Hindi ko alam i-share ka nung mga nakaraan yung yung PowerPoint. Buti ngayon, na i-share ko yung PowerPoint kaya mas magiging beneficial dun sa mga tao na manonood. Kasi, kahit hindi man nila ako naririnig, lang, yung slide naman ay nandiyan. Dapat sa susunod mong duty at kailangan mo ang pumunta sa office. Tawag ka muna sa akin, then masabi ko na available ako. Otherwise, ako available. Isip ako sa head nurse or supervisor para i-cover ako para mag-competency for you. Kung clear naman mag-attend ng personal sa auditorium, okay din naman. Pero kung clear naman yung nakuha mo yung information, ay pwede na siguro hindi ka mag-attend. Kung clear lang naman yung information. Sino po itong 6 na kasama natin ngayon? 6 pa. Ang nandito sa loob, paiwan naman ng comment ninyo, baka meron pa tayong kasama dito for the training or for the fishing. Clear ba? Na narinig? Wabs Makoy? Okay. Clear pang narinig. Uwi na po. So, pretty attended. Yeah. Pretty your head office here. If you attended, if you feel that this is enough, everything is clear, I if it's beneficial, if it's enough for you to attend that online, you will tell me if you will attend the personal auditorium lecture or you will attend the competency immediately. Otherwise, the competency should be done personal. But getting the information, it can be online, no problem. Because this is just attending. But they will attend the competency at 9 or any time of the day. Pretty, it's okay. Thank you so much. Iwan mo lang ang iyong thumbs up dyan. Yola, you know Yola? No, only, I don't know because it's 6. So, sino pa ba dyan ang meron pang 6 na nanonood para lang malaman natin competency na po, sir, sa Monday. So Fritzy said, she can go immediately for the competencies on Monday when she will be on duty. Okay. Your head nurse notified. I already told her. She's just beside me, right? Thank you so much, Fritzy. Mag-aayos lang ako ng konting gamit, then uuwi na ako. Opo. Wala na si Ate Yola. Sino kasama natin dito? May 5 pa. Pwede na po go home, sir. Haha. See, I'm overtime, okay? I'm overtime for the competency, not for anything else. You will be duty tomorrow. It will be day, Kim, because I will ask. I heard your voice that you are complaining. Hey, May, you're here since the beginning at 2 or just now, May? What's the feedback? Because Anup told a while ago, he commented, you watched the live stream. He said that whenever I'm going to the podium away from the laptop, they cannot, they barely hear me. Yeah, I will go home now. Somebody's asking me to go now because I need to go to the market. I need to go and buy something else for dinner. Bakit hindi nag-comment yung iba? I just arrived. I noticed from outside that there is a slideshow. I missed it. Yeah, Miss May, because at the beginning, first day and second day, I didn't share my slide, but now I discovered how to share it. Raj, uh, May is saying say hi to Raji.
Hi, May. How are you?
She will see you. May, will you come now for duty? Now we need patient family educator for the patients. Miss May will answer. Will she come on June? or this month. This is live. This is live, Miss May. This is live. That's why somebody there in the comment section is asking me to go home now. Because is it until now? It's still curfew. Yes, sure. I miss my patients. Yalla. I will tell Abu Shaira if you will come next week. Can you come next week? There's just a short delay, few seconds delay in the streaming, but it's live streaming. I'm still in the office right now with the supervisor. Yes, there. And Miss Raji here. Who are watching right now? It's May, it's Wabs. Who's the other one? Who's the other four? Sino po yung apat dyan na nanonood ngayon? Baka pwede naman silang magparamdam. Maybe they can just leave a comment, press 1, and send to the live chat so at least we know who are with us. I mean, can I return back to see this live again? Can it be saved? Yes. Yeah. After this, or actually even now, you can see that what's this? The pointer is on the live, on the end, on the rightmost corner of the, what do you call this? Of the timeline. If you will press on the, for example, you will go to 2 hours ago, you can do it. Or you will go like 30 minutes ago, you can select the parts where you want to watch. You can do this. Now, you can do it now or even after this broadcast. You can go to wherever location or wherever part of this presentation or this training. So you can just go back, no problem. And you have any question, you can just message me through WhatsApp so at least we can answer if you need any clarification to make. Great, thanks. And this started with your trigger. Thank you so much, May. Because I think this because she asked, she wants that online. Now I'm doing it for the third time. Tomorrow, the fourth time. Thank you so much, May. Wabs Makoy, I'm going home. Who are the six watching us right now? It's May, it's Wabs Makoy. Who's the other four? You cannot. Can you please drop down any comment? Press one, no problem. Press one, press two. So at least I will know who to whom this message is coming from. So at least I know the audience. Huh? So I know Fritzy. I know Fritzy, but she left. I know Anup, and he commented very valid point. Whenever I'm going away from the laptop, if I'm going to the podium to press next, they cannot hear me. So tomorrow I will bring a pointer. So I will stay in front of the laptop and I will not go to the podium to press next. Maybe the other three or other four watching is playing the previous part of this presentation. That's why what I'm saying right now, they cannot hear it. Maybe they're replaying the presentation. Anyway, thank you so much for everyone who joined this. Only 7 minutes, and I will cut this broadcast. So now I will go. I'll just stay for more 7 minutes. Fly away, Caroline pigeon fly. What the show, sir? You have the show, sir? New? Management. Stage 2. You will go to fifth floor? Because I will ask to give to Annabelle. I will go. Yeah. I will catch the ano, the vegetable. Yeah. Bye bye. I thought you will attend tomorrow. Ano pa pasyente niyo? Okay, bye bye. Ay, gusto niyo umattend ng online na lang? Pwede naman. Si Fritzy umattend siya today. Sabi ko, oo. Basta yung competency ay face-to-face. Pero yung lecture, pwedeng online. Kasi dati nag-zoom ako ng competency. Pero ngayon, ang competency ay online. Ay, ano, face-to-face. YouTube Live. YouTube Live, you know? Press thumbs up, like, share, and subscribe. See ya. Promote. Promote the channel. YouTuber. Sino po kaya ito nakasama natin hanggang ngayon? Anim. Miss May, see you. Miss May, see you. Miss May.